Good afternoon, everyone. I'd like to call the Emergency Policy Group to order. Will the clerk please call the roll?
Miller?
Here.
Overman?
Here.
Merman?
Here.
Cronister?
Here.
Castor?
Here.
Ross?
Here.
Lott?
He's having some technical difficulties. He's trying to get on now.
Okay. Snively?
Here.
Miss Wise?
I'm here.
You have quorum.
Thank you. We'll now move into public comment. We've set aside 20 minutes total for public comment. Each speaker will have 2 minutes to speak. Our first speaker is Jill Stake.
Hello, this is Jill. I live in Carrollwood, and I'm calling today because I wanted to let you know that I support the mask mandate. When I listen to the anger from others who call into these meetings, I'm honestly surprised because when I put on my mask and go out in public, I don't see any of that anger. I just see other people also wearing masks, going about their business. I mean, I'm guessing that, like me, they don't really like wearing a mask, but I'm also guessing that, like me, they don't see it as some kind of hardship. It's an inconvenience, like stopping for a red light when you're in a hurry. It's a pain, but you do it because it's not that big of a deal. And everybody's agreed we need to stop at red lights to make driving in traffic safer. I'm just hoping that as committee members, you're taking the time to truly listen to all the facts and thoughts presented to you, not just from those who are yelling the loudest. There is a lot to know about this disease. We're learning more every day. Now, that makes your job a lot harder, and I know that. But you have access to excellent medical advice from experts who are working hard to get you the answers you need. The decisions you have to make, they're not just guesses. Those are based on real facts provided by real experts. That should make your job easier and actually make you feel better. So when it comes to the mask mandate, I hope there's no hesitation in your mind. You're doing the right thing by keeping it in place until those medical experts tell you it's safe to stop. So I'm thanking you in advance for continuing to make our area one where I feel a little safer when I need to go out. This mandate is good for me, and I think the mask mandate is good for our county. Thank you for your time.
Thank you. Jennifer Cantor.
Good afternoon. Hi, this is Jennifer Cantor. I'd like to echo what our first caller just said. I've been watching these meetings from the beginning. I appreciate every one of you who has been listening to experts and trying your best to guide us through a very hard situation. This is not the first time I've called, but I keep calling back because I think that you need the opportunity to hear some of the sane people in your community who are supporting the decisions that you're making. As part of that, I also want to remind everybody that this is one community. As many different neighborhoods and different types of lifestyles and socioeconomic situations as we all have, we are all interconnected. So please, any of the folks who are from a rural area and are representing rural constituents or suburban constituents, please remember, I've been a native, I've lived here my whole life, I've lived rural, urban, and suburban, and we're all interconnected, and there is no way for this disease to blow up in the city and never reach the rural areas. You are protecting all of us, including the rural residents, when you take measures to keep our numbers contained in the city as well as throughout the community. What happens in town spreads out. So please keep listening to those experts and doing the hard things that you've got to do. Thank you guys so much for all of this.
Michael Woodside.
Oh, all right. Hi, my name is Michael Woodside, and and gentlemen of the board, it's a pleasure to speak with you this afternoon. I want to state that I appreciate the opportunity to speak with you via the phone. I hope our other local boards follow suit. Now, I'm sure you're aware that we're on a pretty bad trajectory here. Numbers of newly infected this morning were up to almost 9,000. Hospitalizations are up. ICU beds are down. Percent of positive tests are now over 20%. In light of this, I wish to address a growing concern among the world scientists about the potential impact air conditioning units have on COVID spread. To quote Dr. Edward Nardell, a professor in the Department of Environmental Health and Immunology and Infectious Diseases at the Harvard T.H. Chan School of Public Health, air conditioning units can generate air currents that can carry large particles even further than they'd normally be carried via cough or sneeze. Basically, you breathe out the viral particles and they ride on the air currents, and because it's an enclosed space, it is nowhere to be dispersed. Therefore, even maintaining a 6-foot distance doesn't help if you're in the path of the airflow. Obviously, this makes a lot of sense would account for the spread that we're seeing in bars and restaurants. This could be particularly important now that we're looking at reopening our schools. Thankfully, y'all came around to instituting some precautions. But there is a concern out there about our large school system becoming an incubator for massive spread. I've heard from the schools the same thing I've heard from many local businesses, a lot about Clorox this and sanitize that, but nothing about airflow. As the emergency policy group, it may be prudent for you to consider airflow as a part of the puzzle, and you may want to look into how we can better disperse airflow in indoor locations. Measures should be considered to improve airflow in enclosed spaces, including opening windows when possible. I know there's a fire code issue to consider and so on, but these are desperate times we need to put all of our cards on the table. Whether it's a restaurant or a school, opening windows and other increased ventilation measures can make a huge difference and could be a part of how we get our numbers down again. I urge you to consider these findings and implement strategies to curtail the increased risks presented by airborne spread. I yield my time. Thank you.
Jason Kimball.
Okay, so the first two callers clearly have no respect for freedom or America, and they clearly were not listening to the experts. On Monday, Dr. Wilson and Dr. Chang gave totally meaningless presentations. They put forth zero evidence to support mandatory masks, but you're destroying the economy of the entire county on the basis of their word. Dr. Chang talked about a strategy to mitigate intubation. So thymosin alpha-1 in the study published on May 22nd, 0 COVID-19 patients in the thymosin alpha-1 group required intubation, and they had been hospitalized for 10 days or longer. Dr. Chang said they had 32 patients in Tampa General hooked up to ventilators. So both doctors talked about occupancy. That's really all they talked about. But I think their refusal to utilize clinically approved therapeutics are totally blowing up their occupancy numbers. I'm at least thankful Dr. Wilson didn't parade his dead patients in front of the EPG like Dr. Lakshmi did previously. So this is a very politically charged issue. There are powers that want the numbers to be high because they want to shut our economy down for political gain, including members of this very group. There are 3 core corrupt members, and if you had any shame, I wouldn't be calling
Excuse
you
me,
out.
sir.
But
Excuse me, sir. When you start, excuse me, sir. When you start getting personal, we're going to cut you off. Stop getting personal. Just continue your comments, but not get personal with the members, okay?
Okay, I'm not getting personal, but we cannot tolerate corruption in the EPG, okay? So if you don't want to be called out, just don't be corrupt. It's a very simple, okay? So Commissioner Overman, that's Mayor Castor, and honestly, Chair, I'm very disappointed in you. I don't understand.
You're done, sir. You're done. You're done. Cut him off, please.
Okay.
Cut him off. I asked him not to get personal, and he did just that. Ladies and gentlemen, if you're there, the one thing we want you to do is have your say. But when you start getting personal, we don't want to do that. I warned him once not to get personal, and he did it again anyway. So please, please, make your comments, whether you're pro-mask, against mask, whatever the case may be, but please do not get personal with the members of the EPG. We're not getting personal with you. Please don't get personal with us. Megan Petty.
Yes, hi. Thank you for the time to speak. I just wanted to say that I do agree with Chairman Miller that the EPG should be reserved for short-term emergencies like hurricanes, and that the Board of County Commissioners should be the voting body for long-term emergencies where proper representation can be preserved. I also would like to say that I have looked into how effective mask wearing actually is. And I have watched several people show me personally that aerosols can be pushed through a mask very easily. And so because the numbers are going up, I would say that mask wearing is actually not very effective at all, and that it's caused more a burden on our businesses than it's actually done good. And so I would say that social distancing is probably our best bet, and that even according to the order in Section 5, it does not mandate customers wearing masks when social distancing is maintained. So I would say that if you could just make it a voluntary compliance, it would really help with the situation. And I believe that this whole COVID thing is about ready to come to an end anyway, because we have reached the HIT, which is the herd immunity threshold. So thank you very much for your time, and I will give back the rest of my time to someone who's ever next. Thank you.
Jeff C.
This is Jeff C. Hey, I got to say right off the bat that I'm against the mandatory masks. I'm pro-choice like the last speaker, and I believe that the patient or the population should continue to have the right to make their own health decisions, including whether they wear a mask or not. Colleagues of mine that I've talked to, one's a general surgeon, a few others, they're afraid really to say anything because administration is really in control of us. The numbers just aren't matching up. The numbers we're seeing as far as the ICUs being full, the hospitals being overloaded, ask them if they need more help. They won't hire you. New York wouldn't even take some of the nurses that we wanted to send up there. They didn't need them. Another thing I want to point out too, in the practice of medicine, we use evidence-based research that's done over years, not done over a few months like this. So to make decisions based on studies that meet none of the criteria for a good study, practicing medicine, we just wouldn't do it. We look at the research and we change our practice based on whether it's good research or not. And I'll tell you from my experience, the masks are increasing the work of breathing. They're decreasing the FiO2, which is the fraction of inspired oxygen, and therefore likely increasing the susceptibility for infection and other ischemic events like heart attack and stroke. The people that you see out there, they're constantly touching their faces. They're not used to wearing a mask. They're seeding their mask with bacteria and viruses, and that mask is acting like a nebulizer. They need to be breathing fresh air, and I agree with the last speaker. Social distancing is probably the best thing you can do. But like I said, the numbers just aren't matching what we're seeing. And he works, one of the general surgeons works at 3 different facilities in the 2 I work at. And
thank you, sir. Your time is up.
He's saying he's just not.
Thank you, sir. Leslie Gears.
Hi, my name is Leslie Gears. I am a small business owner and a mom of 2 small children in Hillsborough County. Thank you for the opportunity today to make a public comment. First off, I would like to please ask you to remove the mask mandate. I do not have a problem with anyone wearing masks. That is everyone's right to protect themselves as they see fit for them and their family. But I do not agree with the overreach of power of mandating every single person to wear one. I would like to voice a few questions. If masks are so effective, then shouldn't those that are at risk from dying from this virus be protected if they are wearing one? If masks are so effective, why is the EPG still meeting remote and not in person? If masks are so effective, then shouldn't our number of cases have gone down? Why is the recovery rate and small amount of deaths not at the center of your conversation instead of the fear of dying from something that has a very high recovery rate? Why are there not additional medical opinions being offered? Why were we not concerned last year when 1.5 million people died worldwide from TB? My list of questions could go on and on. As of this morning, 163 people have died from COVID-19 in our county. That is 0.001% of our population. I encourage all of you to do a bit of research on your own, and you will see that the fear that has been pumped through the media with this virus is totally unacceptable. The numbers just do not add up. How much more pressure do you want to put on the small businesses in Hillsborough County that are left? Surely the cure has become worse than the virus. Please, I'm asking to listen and please remove this mandate. People have called and contacted you and emailed you week after week asking you to remove it, but you ignore us. We will not stand for this. Government is here to serve the people, and we will hold you accountable. Thank you for your time and this opportunity to give public comments.
Greg Reynolds.
Thank you, Mr. Chairman. My name is Craig Reynolds, and I've listened in absolute disgust from the callers like the one just before me who talk about high recovery rates, low death rates, and ineffectiveness of masks. But every single place that has mandated them has much, much lower positivity rates. And these same people, as bankrupt as their morality seems to be, do not ever mention the horror of the vast majority of those who get the virus, particularly those in the vulnerable population, who get extremely sick, and they do stay sick for quite some time. The negative intensity that's directed at Chairman Miller today and before has resulted in this committee considering dissolution. But no matter where these matters are decided, all of you were elected with one principal duty, and that is to provide for the general welfare of our community, just as our Constitution says. So to be able to conduct business freely without any kind of shutdowns, to engage in essential commerce, to visit a museum or a small business with your family, this is going to require the community to take precautions against this virus. Our community has made a decision that it is in the health benefits of all that we are not allowed to walk into a public place, smoke a cigarette, smoke a cigar, use a vape, but no lawsuits have been filed by opportunistic state representatives to overturn the smoking bans. I don't hear people complaining about other rules like no shirt, no shoes, no service. If a nudist walks into a public place while nude, is that a violation of his or her civil liberties? I don't think so. The answer is that we establish rules as a community based on common ideals and values that protects the general welfare of our society. Wearing a facial covering, like all of the health experts strongly recommend, is no more a violation of your civil liberties than requiring you to wear clothes in public or to smoke in a designated area, and those things will not even potentially kill you just from one exposure. So I really hope all of you on this board continue with the mask mandate and ensure that other common sense measures are put into place, such as encouraging telework, capacity limits, and strictly enforced social distancing.
Thank you.
Thank you.
Shane Regal.
Hello, EPG members. My name is Shane Regal. I'm from Tampa Heights. First, I want to thank you all for the hours you spend in these meetings. Many of the citizens I'm one of the many citizens that's looking to advance the mask order and even extend it beyond the 1-week sunset. Rehashing this conversation every week is a waste of everyone's time and effort for a problem that operates weeks out. I've listened to this call, I've listened to other calls, I've read the comments and heard public comment, and I can see why it may seem that the mask order is not popular, but what you're hearing is the few, the organized, and the loudest voices. This discussion has been too focused around the impacts to business, enforcement, if it plays well with other laws, or who's exempt. This is the type of minutia that you focus in on when you already have a predetermined decision and you're just trying to find ways to get out of it. Don't blame me, blame the right to bear arms. This is a health pandemic, and no offense, but why isn't there a single healthcare professional on this EPG board? Instead, we have the health professionals coming every single meeting and groveling before the board for some type of action to be made. On the topic of business, we've heard the why nots to have the mask and not the why tos. Having the order allows for businesses to avoid conflict and controversy while they do the right thing. Just as many of you have stated, businesses have been the hardest hit during this time. And the last thing businesses need to do is to stand up for their guests and their staff and exercise the right to require a mask, only to be taken down by the vicious, the galvanized, and the few. Masks help businesses avoid the inevitable future of having to have more shutdown orders put into place. So to wrap this up, I encourage the mask order to stay in place. I encourage to extend the sunset period. And I also encourage everyone to take a stance after the facts are presented by healthcare professionals to state whether you agree with or you refute the facts being presented. At least that way we all know that we're working off the same collective facts rather than predetermined stances. Unfortunately, the federal and the state
government— Thank you, sir. Your time is up.
And that's where we have—
Thank you, sir. Your time is up. Thank you. That closes our public comment section. We're now moving to emergency management update. Mr. Dudley.
Good afternoon. This week has been another week of productive testing. Total tested 53,648. This week, also, COVID testing demands across the nation and in the state continues to make things challenging with lab capacity and testing supplies. We will continue to monitor and work with the state to make adjustments to continue our collections. We have a new testing site scheduled to open July 17th, partnering with Tampa Family Health Center in the Town and Country area on West Hillsborough. They'll be conducting collections on Fridays, 5 to 8 p.m. and Saturdays, 8 to 12 p.m. And to locate all our testing sites here in the county, please visit hcflgov.net/stay safe. This additional site, this will provide 3 sites open on Saturday. Ray J. Brandon Clinic, where we partner with Suncoast Community Health Center, and the new Town and Country site that'll open next week. And it also gives us that after hours benefit. So that'll give folks a lot more flexibility that can't make it during the week to get out there on the weekend. Logistics, we continue to support logistics operation. We started distributing masks at the libraries this morning. We had them set up with 30,000 and they flew off the shelf. So we've had to send out another 33,000, should be hitting the sites as we speak. So the library locations are a good location. The demand is there, and we'll continue to try to support those locations while supplies last. That concludes my update. Any questions?
Thank you, Mr. Dudley. I see no questions at this time, so thank you very much for your presentation.
Thank you, sir.
Public health update, Dr. Holt.
Yes, sir. This is Dr. Holt from the Florida Department of Health. They will again provide our EPI update. I'll be joined by Mr. Wagner. Then we're going to review the contact tracing program. I will review that along with Dr. Marissa Levine. She's the professor of USF College of Public Health. She's also a former health commissioner for the state of Florida, or Virginia, I apologize. Evan, do you have your presentation up?
Yes, sir, it's up.
Okay, so we'll go to the second slide. Just an update. As of this morning, we have 16,670 cases. That's an increase of 565 from this report. While it is a significant increase over the last 7 days, that trend that we noted on Monday does appear to be sustaining, so indicating some leveling at this number. This represents 1.07% of our population, which will over time continue to increase gradually. It also still represents 0.01% of the total population have died. As we'll discuss a little later, the number of deaths we have had in the last week has significantly increased. In fact, we had 19 reported yesterday. The estimated number of recovered individuals is 2,698. That's going to increase weekly fairly significantly as those that who were infected in June essentially passed their 30-day, or in July, I'm sorry, passed their 30-day recovery period and will be added to that list. Moving on to our results, high level, the 14-day average of cases, 655. Again, this is a significant increase, but as we look at closely at the graphs, this flattening of this trend and leveling off is noted and encouraging. Our testing remains strong. As Mr. Dudley said, we're continuing to expand, and we will discuss a little bit more of this under the contact tracing portion of the presentation. And then as final on this side, our 14-day positivity rate remains high, but is also flat at 20%. Next slide. For hospitalizations, currently as of today, we have 437. That's compared to 391 we had on Monday. Looking at the census of those patients that are COVID in the hospital, the 7-day average is 384. There's about a 31% increase. Our bed ICU availability really haven't changed. Our bed availability is still below our 80% threshold, and our ICU bed remaining tight above 80%, but still stable. As I noted, the rolling 7-day average, last time we had to update the data, so it's gone up. It is up on an average of 64, which is a 5% increase. I would also like to note, I don't like to note, but I would note that over the last week, we have seen a significant increase of about 10 a day, or 20% of these admissions are coming from our long-term care facilities. Deaths, finally, again, the rolling daily average has increased and will continue to increase as these most latest ones are reported out into this presentation. Kevin, would you take over from there?
Yes, sir. Thank you. Kevin Wagner, Business Analyst, Healthcare Services Department. Again, as indicated by Dr. Holt, we are at 16,670 cases as of this morning, today. This is represented on the slide as of yesterday. A little over 10% of the population has been estimated testing based upon the pure aggregate count. The age break, we added that back in as requested Commissioner. Again, we are still seeing the age no longer on the bell curve. It's still on the front side of the 15 to 24 age range and the 25 to 34 age range from an aggregate standpoint, and then a fall off on the ages 35 and up, but that is on aggregate. When we look at the 7-day averages of the age groups of positivity of the results, it tells a little bit different story. So again, speaking to the 15 to 24 and 25 to 34 categories, because they're the largest right now, on the yellow on June 24th was the base number I ran. We see 25 and 30% respectively on a 7-day average. I pulled the number in this model on 628 just as another comparison to the base. Again, quite high, but slightly trending down. And then on 7.5 a couple of days ago, the positivity of those age groups are less. Now, again, this doesn't include the July 4th event that, how that will roll out with positivity and positives of COVID-19, nor can I really say that it's a result of the mask order that's been implemented. It's been too short of a time. But again, as we're seeing on the 15 to 24 and the 25 to 34 age ranges in the blue column, a decrease. Now, if those decrease, other things have to increase. On the 35 and up on the 4 right sides, we're seeing the slight increase. But again, I think when we run this on 7/12, we'll have a better understanding. We'll have the July 4th completely focused in on the data, and as well as another week of the mask representation. But again, right now, the blue columns are showing a more aligned bell curve that we're seeing, not just the younger population. Regarding with the positive results per day on number of cases, again, the pure yellow is about 655, 659, depending upon the 7 or 14-day count. As indicated, we're hoping that we're seeing a flattening or a plateauing of the process. As indicated, there was another 560 or so today. Again, we hope this plateaus and eventually decreases. With regard to the testing, again, as Dr. Holt indicated, we're doing very well. Of the last 14 days, 10 have received results over the 2250 benchmark set out by Dr. Lockwood at USF. So 10 of those 14 days, we're getting more than 2250 results each day, which again leads into the positivity rate and positive number of cases. So they are all correlated. With regard to the positivity, again, plateauing at 20% for most of the last 14 days, which again supports the testing and the number of cases received. So they all are correlated together. The hospital admissions, as indicated by the hospitals per day on the previous day for COVID-19, is somewhere in the 60 to 63, 64 range average on a 7-day average. But again, that trend is consistently going up on the hospital admits as reported by the hospitals. When we look at total hospitalized, again, that trending is going up with the far right-hand side of July 7th, in the blue diamond. Aggregate 425 of that 341 were admitted in the hospital, were not on ICU, and then the remaining 84 were in ICU in the orange square. But again, those numbers are we seeing an incline on the 7-day and just daily average. ED visits with COVID-like illness, as reported by the FDOH. I don't believe this was updated from the Monday presentation, but again, that is presenting in the ED department is showing an increase, continual increase. As requested on the Monday meeting, Dr. Holt received a breakdown of the inpatients by age group from the hospital systems. We only received partial results, so we just purely put those boxes up here to show you. System 1 had 611 that they reported. A vast majority of those, 57%, were in the age of 65 plus in the inpatient in their system, and 40 to 64 were 30%. So those numbers right there are nearly 90% of that hospital system were in the middle age and greater than 65 range of that one. While system 2 was a little bit more spread out with their inpatients of their age ranges, anywhere from 20 to 25% in every 10 years or every 20 years, how they provided the data to us. So again, this was a request on Monday, just trying to show the age ranges as reported from the hospitals directly, not through the FDOH data, but as reported through the hospitals directly, what their inpatient age groupings are. And I'll stop there. Thank you.
Okay. I see some questions. Commissioner Overman, you recognize.
Thank you, Chair, and thank you, Dr. Holt and Mr. Wagner, for these reports. If you could bring up slide 6 again, the one that talked about the averages. While it's great to see that we've seen a decline in the 15 to 34 age in terms as compared to the spike we've seen, it is a little concerning that we're starting to see not only more exposure under the age of 14 and an increase between, say, 35 and 54, especially in the 55 to 64 age range. That's concerning because those are the individuals that, at what looks like, are those that are more likely to be admitted to a hospital, with the exception maybe the children. But having this comparison, and I want to thank you for it in here, is going to be important as we see this virus respond to the mask orders, where people are less likely to infect people they come in contact with, but also as we approach more people coming in touch with each other as school opens. So the issue I have is really relates to the contact tracing later. We still don't seem to have a good number on the numbers that are tested that have children in their household. And I would imagine that's part of a contact tracing report, but I've asked for that for quite some time, and I'm not seeing it in the contact tracing report, but I'm also not seeing it here. We are seeing a number come up. Is there any way to get that data? from any source at this point? Whether it be the hospitals or Department of Health?
This is Dr. Holt. The only data, and we will talk a little bit about that in the contact tracing, as far as a positive case, they do an interview that gets demographics and ask about who's in the household. As far as whether that is specifically put in a searchable category, I will confirm, but I've asked for that, and they have not been able to extract that from the data tool called Merlin that they entered in. So if it doesn't have a data field that says yes or no, I can't query that.
Okay, and I appreciate that. My concern is for multi-generational households, which are frequently multi-generational for primarily two reasons. One, it's cultural. They tend to be close together. But two, economically, they're dependent upon each other. And seeing where the spread's going, where the age is, where the workforce is, and then how it's impacting both children and seniors, I think is an important risk factor that we need to be able to address. And that's why I keep asking for those numbers. So I appreciate that it's apparently not available, but I'd love to explore ways that we can find better ways to find out. So I thank you for the data. It's been very, very helpful. I'll stop there.
Okay. Dr. Holt, please continue, sir.
Yes, sir. Next, I'm going to do a review, provide a review of the contact tracing program. This is a public health containment tool used in our disease outbreaks. I'll provide a relatively simplified explanation of really how it's done and the goal. I want to review our current workforce, what we've mobilized, our operations, along with providing an update on the additional resources that are going to be coming online. We'll also ask Dr. Marissa Levine. She's a professor at USF College of Public Health and also former State Surgeon General or State Commissioner of Health of Virginia. She's going to sort of put contact tracing into the context of overall public health response to COVID, both where we are now and as we go ahead. Just as an introduction, contact tracing is one of our tools in our toolbox. It's could be one of our weapons as in our armory. But we can't go forward without mentioning that the most important tool that we need as that for all of us to continue to do what we can to not become infected or to infect anyone else. And we all know what that is. So the same thing that Governor DeSantis, Surgeon General Rifki's continue to advise. COVID is an illness that spreads best whenever we are together, when we gather. For whatever reasons, doesn't matter, and especially if we're indoors. Not about really typically this exact place, the settings, or the situations, but it's any time we're together. So if we can do more of that part of the efforts to reduce the social distancing, the hand hygienes, and the mask when appropriate, then we'll have to do less of these other efforts. The purpose of contact tracing is to identify someone very, very quickly. Ideally when they are still actively infectious, so we can ensure they are safely isolated, and then quickly reach out to those that we've already infected before they can infect anyone else. This is the breaking of the chain that we've talked about. It is most effective in times where we do not have widespread or certainly community-based transmission, but rather we have either low level or very hot pockets of transmission. The mitigation tools that I think we've all got quite familiar with, are those that are designed to bring the burden, the amount of the virus down to those levels. Some of our colleagues or some of our residents, such as our elderly, are still in effectively safer at home. Long-term care visitations remain restricted, and now long-term care staff are being tested, mandated. Our hospitalizations, while noted in some of the audience, doesn't seem to be threatening, but we've already implemented mitigation efforts because of the stage we're in, such as University Village, and also in some areas of our Tampa Bay have stopped performing elective surgeries. So this first slide here that you're seeing is essentially what it's all about. Contact tracing should first be thought of as a combination of three parts. You need all three to be most effective. It's called testing, tracing, and supportive isolation. Testing is critical because you must have a supply to exceed the demand. Dean Lockwood gave us an initial target, which we have exceeded. But that was a floor. It was designed to provide us information as we mitigated and could monitor, but not to suppress or contain the virus. The estimates are that we could need up to 3 times what we're currently doing to fully suppress the virus. While that is not possible now, but we are in a long fight, and our capabilities and how much testing we have will continue to increase. And I believe also we'll see newer types that are quicker and easier as we continue to battle. The theme will always be use everything you got, the best you have. But our end goal is, because if you can see this, our goal is that we want to catch that person, identify that case, that single blue dot in the middle is the one that they either onset of symptoms, or if they're asymptomatic, they had collection of a test. Ideally, you would like that result to come back about 48 to 72 hours from either the onset of that illness when they first wanted to be tested, or when we contact them and say you've been exposed, you should get tested. That allows us to do the isolation of the infected while they're still contagious, and quarantining the exposed if they're not yet infected, which again, the latter part of the supportive isolation we have here with both our quarantine and our isolation hotels for those who are unable to do that online. Delays in our testing does create a risk that those that are infected were not isolated during their contagious period. It's also harder for them to remember where or who they were with if it was some time ago. And for those that were exposed to their contacts, many of them may have already become infectious by the time we reach them. So next slide. So this is really the infographic of what, so we'll start up on the far left. So the very first start of this, first step, is the Department of Health gets notified of every day we receive and run a report of all the newly found positive cases for residents in Hillsborough County. We collect their name, date of birth, age, phone number, and address, and we sort it by age to begin to prioritize our case investigations. We also sort it by zip code, looking for common locations such as homes, group homes, multiple families, apartments, and other types of things that come to our attention so we can focus on a potential cluster. The third site we do look at is our county health department collection sites, because These are focused on the healthcare providers, first responders, and other critical infrastructure workers, which are also part of our prioritization, which we'll discuss or review later. So this list is now distributed to our case investigators, and they begin to make their calls. When they reach someone, they ask first their medical condition. Are they okay? Make sure that they are well. Are they safely isolated? And do they know how to prevent spread? We can provide some assistance, again, isolation hotels, PPEs, and others if it will make their home isolation safer. We then complete our social and demographic information, define the onset of illness. That really drives when we can determine they were infectious. That's why asymptomatic positives are challenging, because you don't know exactly when they actually truly were infectious, and you just have to assume that their infectious period began 2 days before their test, but it is an assumption. We then ask very personal and close questions about where they've been, who they were around, anyone close. Everyone has heard the face-to-face within 6 feet for 14 minutes are defined as a close contact. We also look for large gatherings or events that they will acknowledge being at. So if you look at the figures in the top, so if we have identified a contact from that case, we call them, and if that contact person says they're sick, they get tested, or in some cases they've already been tested, we ensure, just like we did with the case, that they're safely isolated well, and the cycle repeats, and we keep going until that chain ends. If we contact a person and they're non-symptomatic, tested negative, they remain on quarantine for 14 days. It is voluntary, but we do offer a hotel if they wish. And we check on them daily to make sure that they remain well and in isolation. That is usually done by texting if they wish, but we will also make calls if they prefer. The third box is the challenging ones, where we don't get information. And just talking and estimating, and this is just in the last month or so, about 10% of the phone numbers that we initially receive are inaccurate or non-working. About 15 to 20% of the calls that we do make and leave up to voicemail 3 times, we're not receiving calls back. Of the remaining, about 80% of the total, or thereabouts, about half of them will decline to speak with us, or they'll mention that they've already been told that they were, or I'm sorry, that everyone that they know, they've already told to get tested, so they don't really need to let us know that, or in some cases they haven't been around anyone. We do provide them information and links so that they can have materials as far as what to do to share regarding self-isolation and quarantine. For the rest, we get that list and we work it, as I've said, on the far right. If we find a contact who is symptomatic and they're weren't around anybody and they have no secondary cases, that concludes sort of that chain, if you will. So next slide. The high levels, what we're looking for in effective contact tracing is timely results. get that accurate contact phone numbers, getting responses to our calls, cooperative interviews, and compliance with isolation and quarantine. And with that, in the working, this tool will break the chain for those times when we can identify the majority of the cases that are occurring in our community and implement this tool. Next slide. Because of the number of cases right now that we're dealing with, we prioritized, and these are our priorities. We start priority ones: hospitalized, healthcare, first responders, long-term care facility related patient residents or staff, congregate setting, shelters, prisons, there's a list, congregate our large households, as was mentioned earlier. Then we look, those are the ones that are a mixture of critical workers and vulnerable people in congregate settings. Then we look at our second priority is those that have the most risk for severe outcomes. In addition to the critical infrastructure workers, priority 3 is our symptomatic and 4 is our asymptomatic. Next slide, please. So here's what we are now. Our current staffing internally is a core group of veteran epidemiologists that have been augmented internally by health department staff. Most of them, their normal job is out doing tracking down tuberculosis cases, HIV, sexually transmitted disease, looking at foodborne outbreaks, or any other disease transmitted type of efforts. In addition to that, we have sort of all hands on deck. We've also been received support from the state through teams that are deployed. They rotational basis, and also we have access to a remote case investigation contact tracing staff. Combined together, that totals about 83 people. As I think was discussed, and again, much appreciated, in early June, we spoke and the EPG provided access to $750,000 of CARES funding, which as of July 1st has been made available to us. We are hiring, and actually we should have 20 staff on board this coming week and 20 more after that. Our priority use of this at this timing right now is going to be creating 8 teams, two-person teams, that is going to be linked up and supporting the school reopening, both from an infection prevention, case investigation, and contact tracing. We're also going to establish a dedicated long-term care investigative team. The state has also provided us through funding and now the hiring process that I'm hopeful we'll see some probably around the late of this month or early August that will essentially double our workforce. So my hope is that by August, we will have approximately 239 people, split about 50-50 case investigators, contact tracers. This doesn't include some supportive staff that we would have and others in our facility. That this will serve us as we go forward in this effort to get the virus suppressed and contained, and eventually we won't eliminate it, but we will get it back to where it is not a threat. With that, I'm going to ask Dr. Levine to make a few comments, and then we will be available for questions.
Thank you, Dr. Holt. Can you all hear me?
Yes, ma'am.
It's a pleasure to be with you again, and I thank you for the honor. I want to thank you all too for your service. Having been in a position and dealt with pandemics, what you're doing is not easy. Unfortunately, I don't see it getting any easier anytime in the near future. So Dr. Holt asked me to try to put the contact tracing into context. And I have three key messages I'd like to share with you, an important resource and some detail. So the first one to keep in mind is, well, what's our goal here? Where are we trying to get to? And I think one of the things that the EPG ought to consider is that really to be effective in containing this pandemic locally, we need to be back to the point where we're dealing with about 14 or 15 new cases a day at the most. The last time we were there was April 28th. And that number just doesn't come off from anywhere. That's about one new case per 100,000 population, which is a recommendation that I'll get to in a little more detail. You know that Hillsborough is currently in widespread community transmission. That's obvious to you. That has huge and significant implications for contact tracing and its effectiveness. And because of that, really there's no magic panacea at this point. We really need all the actions to be activated, and we need all of the individuals in the community to play a role, as you've heard before. So what I'd like to do is just make sure you're aware of a new report that came out of the Harvard Global Health Institute in collaboration with a number of other esteemed entities that have been watching in detail and studying what's happening not only in the country, but around the globe. And you know there are some developed countries that have managed to get their arms around COVID. And I think there's some really important messages back to you. They specifically designed this report, which I'd be happy to share the link with you so that you can take a closer look. But it helps localities down to the jurisdictional level of the county to understand their situation in context of risk of COVID and COVID transmission, some key metrics to consider, and quite frankly, you're considering all of those, and then some recommended actions based on where you are at the time. So I've looked at that framework. I've looked at the numbers going on now, and you fall in the highest level of risk of transmission, no surprise. Florida itself is certainly up there, ranked against other countries that have significant outbreak right now. And when we think about this, there are really two options here. One is, do we mitigate the impact of COVID? Do we make this less impactful to our community, or do we work to try to suppress it? Ultimately, we want to try to suppress it, literally contain it. We're not able to do that now. And so the recommendation is to make sure that we push toward mitigation, and Dr. Holt's talked about this. This is not going to be done alone with testing and contact tracing at this point. I think that's a fair assessment. The Harvard report, if you look at it, you'll see that the recommendation at this stage of the game is to have about 30 contact tracers for every 100,000 population. That puts for the Hillsborough County population, you're talking about over 400 individuals. And even with that number, knowing the workload and knowing what you just heard in terms of what has to happen, and in all likelihood, the lack of support from some community members to participate, it still would be difficult even with that number. You also need more testing. And the Harvard report estimates, as you heard Dr. Holt say, somewhere in the neighborhood of 2.5 to 3 times more daily testing than you're doing now. Neither of those are realistic for lots of reasons that are well beyond your control. So I'm not asking you to do something that I know you can't do. I just want you to be aware. Right now, what's really important is that you continue getting the messages out that everything you put in place, plus the public's ongoing continued support where everybody's doing their part, is the only thing that will flatten this curve and get us back to a level where testing and contact tracing will have a greater impact. I think it's important, as you've done, to support the buildup of our testing capability and contact tracing so that you get to the 230, 240 individuals that Dr. Holt is talking about. But quite frankly, before they're going to have full impact, we have to be at a place probably with less than half of the new caseload that we have right now for them to be able to do their work. As Dr. Holt said, he's prioritizing now because his folks are stretched. These people, I know because I've worked with public health folks my whole career, They're very passionate. They're working hard. They're probably very tired, and they've got a lot more work to do. So your support, I know, is really important. But I wanted to be clear for you that even though contact tracing is an important part of the puzzle here, just getting those individuals alone is not going to get us to where we need to go. I think you're seeing, in terms of the data that was just presented to you, that the mask ordinance, the other orders by the governor, and quite frankly, the work of the citizens is working toward getting us to where we need to go. I hope you don't, similar to what you heard from many of the callers, I hope you don't take away the mask ordinance too early, because it's too soon to see its full effect. And I would recommend that you continue your efforts to vigorously get the message out about what's needed right now. Dr. Holt mentioned that he's not getting good support in terms of the individuals they are reaching out to, either not answering calls, returning them, or even participating in the conversation needed for the contact tracers to do the work. I think it would be helpful if you get that message out and let people know this is part of getting this curve down, decreasing the risk to the community, and getting us out of widespread transmission. Widespread transmission is not good for anybody. You will know, you need to know when freight now go up, which quite frankly is not unexpected, given the change in the demographics of people being hospitalized. That the last thing I would encourage you to do is continue to get the word out to the most vulnerable of folks in the community that they are at risk as they go out, and they need to take extra precaution and probably in all likelihood limit their mobility as much as possible. So in closing, public health has the word public in it for a good reason. Nothing done in public health can be done without the full cooperation of the public. This is a really important time in Hillsborough's fight for the pandemic, that we have an aligned and focused effort where the public is working with you and following the things that you put in place. So I ask you to stick with it. It's not going to get any easier, but you've got a lot of good people working on this, and it appears to me that the community is rallying despite some of the voice you're hearing. By beefing up the testing and the contact tracing, when we get to a lower point of new cases, we can actually start to wrap our arms around this and prevent a third wave of coming. So thank you, Dr. Holt. Thank you, Chair.
You're welcome. Dr. Holt?
We're available for questions. I just want to make a point that, and I support what Dr. Levine mentioned, contact tracing is doing some good here. I don't want anybody to believe that we are not making some benefit either. It's difficult, but we are finding we're helping, but we'll need 30, or the numbers that were outlined, and I reviewed the material Dr. Levine showed me. They actually have us needing 30 per 100,000, no matter if you're just having 100, 200 cases a day, much less what we have. So, and that's because it really will, it's going to be a critical piece. It is helpful now. We're going to have seasoned veterans, we're going to have focus targets, and I just want to make sure that the impression is not left that we can't benefit and make a difference with what we have. We just need everything working together. And I apologize for that editorial. I'll stop there and welcome questions.
Thank you, Dr. Holt. Thank you, Dr. Levine. Let me ask a question. There was an article that came out today that says Florida is now the world's epicenter for COVID-19. And also there was an article that came out that said that of the 6 counties that have the most cases of COVID-19, 4 in Florida, and we happen to be one in Hillsborough County. Have you been talking to anyone, say in Miami-Dade or Broward or Monroe, who has been having some very high numbers? Are they having the same issues if they're doing contract tracing? Are they having some of the same issues?
Oh, yes, sir. Very much. It's a hot topic within the state. And, you know, again, we do not use technology. We don't have ways to perhaps mobilize some of that. So right now our processes are very labor intense, but we are experiencing the same similarities of both overwhelmed and some challenges to get. And I think it's important that I shouldn't be characterizing as non-cooperation as much, but like I said, in some cases, people have already recovered by the time we're reaching them. They feel it's already over. There's nothing more to contribute. And I think that's just the way they understand it. It's just how they view things. But all of these that I mentioned really are characteristic across our counties in Tampa Bay, Orange County, Duval, which are sort of our own hotter areas, and certainly Miami-Dade is kind of an extreme. They're an even higher magnitude, but they also have more resources. So on a per capita basis, we're all in pretty much the same position. I'll stop there.
Okay. Commissioner Overman, you recognize. Nice.
Thank you. And thank you, Dr. Holt and Dr. Levine, for the information. It's really helpful to understand not only the process, but also the order of magnitude of the challenge. You know, with 650 to almost 700 cases a day, it is a mammoth task. I have two questions. One, I personally happen to know a young woman who works in a skilled nursing unit and is tested positive. She called me Monday and said, you know, I'm on day 8 and I just got the notice that I'm positive, but I've been home. But she hadn't heard from anybody as far as the contact tracers or investigators or anything like that. And so is there a way that someone who does test positive to reach out to the contact tracers to do the tracing? Because if they're not getting the calls, or where there's not a connection between the investigator and the tracer, is there a way that a person who has tested positive that is concerned about spread and the people they've come in contact with, that they can contact?
Yes, ma'am. Great question, and there is, and it's a. I can give the number. We'll put it out through our JIC, but it's 813-307-8010. The long-term care employees, she won't be the only person we haven't yet reached. It is when you're overwhelmed, it's going to take us time to get around to everybody. And the long-term care, while is prioritized, it also involves working with her employer, which is an added variable, and as far as how that her work, how her contact tracing. So it's a joint effort. It's a little different than the general public, but you have identified a big challenge for us is how can we make that information more available to them before we can get to them, because that's critical.
Thank you. Because she made mention of an app that she could download on her phone to help, but I don't know if that's connected to the Department of Health. Is that data come to you if she were to elect to utilize that?
We do not have an active app at this time. There is, there is some links to some materials that people can go to, but it's not part of an app. When people are tested, particularly the long-term care, many times they're given an app so they can get their results. I don't know if that's the one, but the Department of Health does not have an app for someone to load or any use of technology in that.
Okay, because what I was trying to discern is, if we have an online application process for taking a test, And if we ask the question, you know, do you have children in your household under the age of 18? Do you have a senior in your household over the age of 65? Or are you showing symptoms or not? The questions I've been asking might be available if it tracks with that test. But yeah, what I'm hearing from you is technology has not been your friend or access point. So I'm thinking there may be a way to help with that contact tracing, given that we have a huge volume that we need to address, and see if there's ways that we can solve that problem to make sure that we know where their biggest risks are in the community, especially in those multi-generational families. And that's why I'm sort of going down this line. So, but thank you so much for your work. I'm hoping that we can help our contact tracers, investigators get the job done. So let us know how we can help you. Thank you.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And again, Dr. Levine, Dr. Holt, you guys are really hitting it out of the park, coming to us with this great plan. I just want to ask you a quick question. Schools are going to open, and I've been reading and listening to a lot of people talk about having contact tracers available, because if and when any outbreaks do occur in a school, that would be the perfect place to put them. Have you all discussed that yet? And what is the plan going forward?
Yes, ma'am. Thank you. I should have made it a little clearer. Yes, you know, we have a long-standing relationship with the school health, fantastic relationship with the nurses there. So we're going to provide about 16 staff that are going to be experts in additional for both infection prevention type of things. How can you proactively try to reduce transmission in that setting, but also, of course, how you can promptly and quickly investigate a positive case, whether it's from a student or a staff member, and do the accompanying contact investigation. It's an inevitability. We're not, while we have primary responsibilities for formally doing the information, putting it in the data system, our school health nurses and team have been vital partners in any efforts to keep their students and facilities safe. So they'll be sort of our deputies, if you will. But the CARES fundings that you and this EPG provided is going to be focused on that particular project. I'll stop there.
Oh, good. Okay, thank you very much. And I know 3 weeks ago, when it was really becoming such an outbreak, I know you, when I asked you about contact tracing, you said it's so widespread, I'm not sure how effective it would be. And I think today, you've really turned the corner with this plan. I think it's very good. So I appreciate all your efforts. Thank you.
Commissioner Overman, you recognize. Commissioner Overman?
My apologies, I forgot to take it down, thanks.
Okay. Well, Dr. Holt and Dr. Levine, I see no more questions, so thank you very much for your presentation. We really truly appreciate it. Thank you very much. County Attorney update, Ms. Beck.
Yes, good afternoon, EPG board members and Chair Miller, Christine Beck, County Attorney. I have 2 very brief items. The first is just to state once again that the governor has issued an order this week, Executive Order number 20-166, and this order by Governor DeSantis extends the state of emergency for the state of Florida roughly through September 7th. The state can extend their state of emergency on 60-day increments, and we have 7-day increments, which brings us to item B, which is the extension of our local state of emergency, which we have prepared and submitted to you in your backup. And at this time, Mr. Chair, it would be appropriate to entertain any motions relative to extending the local state of emergency.
So moved.
Is there a motion to motion by Commissioner Overman, second by Commissioner Merman? Is there any further discussion on extending the local state of emergency? Any further discussion? Seeing none, please call the roll.
Miller?
Yes.
Silverman,
Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 8-0.
Thank you, Mr. Beck. Is there anything else you need to bring forth?
No, sir.
Okay, thank you. We're now moving to EPG discussions. Is there anything that any member would like to discuss today? Anything that any member would like to discuss today? Anything any member would like to discuss today? Commissioner Overman, you recognize.
Thank you. I just would like to ask Ms. Beck to update us on the motion made last meeting regarding wearing the face mask by those who had a concealed carry permit. There was some questions about how that was going to affect us and definitions that the research that you did. Could you update us on the research that you found and related to us on Tuesday?
Yes, Mr. Chair, if I may.
Yes, ma'am.
There is no prohibition in Florida law for holders of concealed carry permits. There's no prohibition that they cannot wear masks. And moreover, if they were to wear a mask, there's no provision in Florida law that would result in them losing their license. So the order as written simply states that there is no conflict with Florida statutes. There honestly never was. And right now, just because you're a concealed carry permit holder, you would still be subject to the order and subject to the mask or the face covering requirements when inside of a business and not able to social distance. Did that address your question, Commissioner Overman?
Yes, ma'am. Thank you very much.
Ms. Snively, you recognize.
Thank you, Mr. Chair. I had two questions actually, and I think maybe one is for Dr. Holt or maybe Mr. Dudley, but we talked about a dashboard similar to the one that was shared from, I believe it was Sarasota County. It was, a snapshot. And I know that I'm guessing the first couple of slides that are shown in Dr. Holt's presentation is that the dashboard that has resulted from the request, or are they still working on one that looks more similar to the dashboard from Sarasota? And the reason I ask is just because the dashboard example sent from Sarasota is it's very easy to read, and it has a lot of information on one page, and is something that can be shared quickly with the public on a pretty regular basis. And so could he possibly address that if he's still on the call?
Ms. Snively, I think County Administrator Bonnie Wise had some information on that last meeting. Ms. Wise, do you want to comment on that?
Yes, sir. Thank you for addressing this. At my report on Monday, I did share that we were planning to have a dashboard by the end of this week, and the intent is to still do so. Some of what you have seen today by both Mr. Dudley and Dr. Holt will be incorporated into that dashboard, but it'll be a more streamlined where it would be available to everybody. So I was hoping for today. It's not today, but Liana Lopez will get it distributed as soon as it's available. It'll be just a few days.
Thank you. And thank you for reminding me. I apologize. I do remember now that you had mentioned that at the last meeting, but as for many of us on the EPG and probably for you too, our days are running together very quickly. So, and then the other thing I wanted to share with the group is a little bit of an update from the school district with regard to masks. Many of you have probably already heard that the superintendent has made the decision to require masks for students going back to school. There is still a lot of information to be worked out, many questions. from parents to be worked out. We are having a school board superintendent workshop next Thursday, and we'll hope to get some additional questions answered about what that looks like logistically. Obviously, it's going to be pretty challenging based on some of the conversation we've had in this group with younger students trying to keep the mask on during the day. And there will be several, there will be some exceptions and accommodations and breaks for students, but we hope to have it pretty much locked up before we start school so that people can understand what that's going to look like from the bus stop to entering the school to being in classrooms and then back to the bus stop. So please let your constituents know that that will be a requirement, and then if things change for the positive, perhaps the superintendent may change the requirement. It really depends on the data and the information that he's acquiring through local health professionals and experts. So just wanted to share that with you in case any of your constituents have questions or concerns about that. And we hope to continue to get more information out to our parents and faculty and students as soon as possible. Thank you.
Ms. Snively, can I ask you a question?
Absolutely. Yes, Chair.
What has the county, what has the school district, the school board, have they taken into consideration of when they open up schools again, be it a student, be it faculty, be it staff, those folks, those people, those persons that are, say, susceptible, highly susceptible to contracting this virus, many of them may be cancer survivors or going through cancer at this particular point in time on chemotherapy or high blood pressure or diabetic, puts them in a very vulnerable position. Have you all talked about what happens with those folks?
The superintendent and the school board and the superintendent's leadership team continue to talk about solutions for those who are more vulnerable with regard to students, because we have two different groups. Obviously, we've got students and we've got faculty to be both concerned about. So for students who are more vulnerable, if the parents do not want to send them back to school, even with the mask requirement, if they feel that they're too vulnerable, then they have the option of distance learning from home and having instruction from home similar to the distance learning that took place the last 9 weeks of school, or they can also enroll in Hillsborough Virtual School or Florida Virtual School. And so that's for the student. They do have choices depending on their level of comfort. And then for the faculty, because we are anticipating that not every student is going to return to school at 100%. We are anticipating that the faculty members will be needed to teach those distance learning classes or those virtual classes, because not every faculty member is going to feel comfortable going back into the classroom either. So they're working out with choices with the Hillsborough County Classroom Teachers Association. They're working closely with that association. And as well as getting feedback from teachers on trying to figure out what the best options are to keep our teachers and our faculty safe. And of course, the superintendent is trying to get an idea. He has put a declaration of intent out to parents to try and get an idea of how many parents are and how many students are going back to school, so that he and his staff can determine what level of staffing is going to be required in the classroom versus online or virtually or distance learning. So yes, that was a long answer to your question, but yes, all of those things are being considered because it is a very complex situation. And we will do our best to answer as many questions as they come up over the next couple of weeks so people can make their decisions.
Is that the same thing for your administrative staff that's not in the classroom and your custodial staff?
Same thing, absolutely. All concerned with what we are able to do for our custodial staff, for administration, anyone who's a non-classroom teacher. Those are all considerations being made.
Okay.
Thank you for that question. Great question.
I'd like to hear what you all have to say about that one, please.
Well, it won't be easy. It's definitely a very challenging situation, but I have a lot of faith in our new superintendent and his leadership team that they will get through this, and we'll all get through this together, but they will do their best to make sure that safety and health of our students and our teachers and our faculty members and any employees are taken into consideration.
Okay, thank you. Commissioner Merman, you recognize.
Thank you, Mr. Chair. This question is for Ms. Beck. I forgot to ask it when we had you on the schedule on the agenda, but several doctors have asked me about this situation where patients have come to them to get tested, and the employers are requiring the employee to provide the results of the test to him or her, the employer, and the results of the test for anyone else in the household. Is that legal?
Commissioner, that sounds like something we would want to do some research on before opining. It doesn't at first blush mesh with my understanding, but I would like to do a little bit more research if we could and bring that back to your next meeting.
Okay, thank you. I appreciate that. It's coming up. It came up once, and I was just going to call you, and now it's come up again. So I think people are getting nervous because it's such a widespread transmission right now, and employers are trying to protect the other employees from anybody that may be testing positive. So, but I would think because of HIPAA or something, I would not think that it would be legal.
Yeah,
But
that was
I'm
my
not
initial thought, but because we're in such unusual times, I would like to just double check and consult with my experts in the office and then report back.
Okay, thank you very much.
Thank you.
Okay, I see no hands at this particular point in time, so I'm going to say that ask everyone to have a safe weekend, and we'll see you again on Monday at 1:30. So, seeing no further discussion, we'll adjourn.
Have a good weekend.
Thank you. Thank you.